Imagine waking up in future. You go to your local clinic, but instead of a doctor in a white coat, you're greeted by an AI system. It reviews your vital signs, your genetic data, your entire medical history, and within seconds it gives you a diagnosis, a treatment plan, maybe even recommends surgery options. Sounds like science fiction, right? Well, not quite. Right now, AI is quietly yet powerfully transforming the very foundations of healthcare. We're talking diagnostics, surgery, patient care, and the pace is only accelerating. In this video, we're going to understand how AI is stepping into medicine today and what doctors are doing with it. Let's jump into the exciting clash between machines and humans and see where we might end up in the next few years. We invite you to imagine an incredible collaboration between human and machine. First, let's think for a second. What does it really mean to be a great doctor? It's diagnosing diseases from patterns that only years of experience can teach. It's performing surgeries guided by intuition, precise judgment, and incredible manual dexterity. But it's also about empathy, building trust, having crucial conversations, and navigating uncertainty. Doctors train for years, mastering anatomy, physiology, pathology, the true art of healing. Their decisions often involve incomplete data, ambiguity, patient values, and complex ethical considerations. So, when we ask, can AI replace doctors? We first have to acknowledge, it's not just about running algorithms. Being a physician spans science, art, and profound humanity. Yet that doesn't mean AI can't completely change the game. Let's see how it already is. This is where AI is already yielding surprising gains, diagnosing diseases, sometimes earlier or more finely than human eyes ever could. Take medical imaging like X-rays, CTs, or MRIs. Deep learning systems can now detect tumors, fractures, or tiny lesions with incredible precision. Studies are showing that AI models can sometimes outperform human radiologists in spotting early disease indicators. Here's a real-world example. In the UK, an AI tool called See the Signs, used in general practices, increased cancer detection rates by roughly 8% just by analyzing patient records and prompting doctors for extra investigations. Some AI models are even detecting preclinical signs of diseases like Alzheimer's or kidney disease years before obvious symptoms even emerge. In pathology, digital pathology uses whole slide imaging combined with AI to assist or even make primary diagnoses. Believe it or not, about 50 AI systems are already cleared for use in diagnostics in Europe alone. And on the administrative side, generative AI models are being tested to transcribe doctors' notes, structure patient charts, and dramatically cut down on paperwork time. But of course, there's a natural tension here. Trust, interpretability, bias, regulation. Clinicians often find themselves in a nuanced position, choosing to ignore, trust, or negotiate AI recommendations, rather than blindly following them. What if the AI misdiagnoses? What if the mistake is hidden deep in the code? It's a complex landscape. Now, before we move on to the operating room, where error margins are razor thin, if you're curious to go deeper and stay updated on these incredible advancements, please hit that subscribe button for Surviving AI. Your support helps us keep exploring these vital topics. Alright, surgery. This is where the stakes are highest. Live tissue, bleeding, immense risk. Can AI truly be trusted here? Robotics are already well established. Think about robot-assisted laparoscopy, the famous Da Vinci systems, or guided surgeries that beautifully augment human hands. AI and machine learning models are now helping plan the surgery itself, simulate tools, and map precise trajectories. Augmented reality-assisted surgery, or AR, overlays guidance and visuals directly during operations, essentially giving surgeons digital X-ray vision of internal anatomy. In endovascular interventions, AI is even being studied to autonomously navigate catheters or wires. While still experimental and no live human trials yet, this shows incredible promise in potentially reducing operation times and radiation exposure for patients. Here's a dramatic example. Researchers at Johns Hopkins recently developed an AI-trained robot that successfully completed a gallbladder removal in a pig with 100% success in multiple trials. It ran on its own but still had a human watching over it. However, let's be clear. We are still far from fully autonomous surgical machines operating on humans. Most current systems are surgeon plus AI, that is hybrids. Ethical, safety, and regulatory frameworks absolutely must evolve alongside this technology. Surgeons remain ultimately responsible, but their role may shift to that of a supervisor, a planner, or an auditor. So, the big question, would you let a robot operate on you under supervision, or with a hybrid AI assist? It's definitely something to ponder. Now, in our next segment, we'll explore how patient care, far beyond just surgery, is evolving with AI. Diagnosis and surgery are only one part of the story. The full continuum of patient care, from home monitoring to post-op recovery to chronic disease management, is being profoundly changed by AI. Think about remote monitoring, sensors, wearables, continuous vital sign tracking, and smart alert systems. AI can flag worrisome trends early, providing crucial danger signals before they escalate. Predictive analytics, by analyzing huge patient datasets, allow AI to forecast complications, readmissions, and the risk of deterioration. Virtual assistants and chatbots can triage symptoms, advise interventions, and even perform follow-up checks, making healthcare more accessible and timely. AI is even making strides in mental health, with chatbots and therapy bots offering initial counseling, mood tracking, and crisis detection. Within healthcare systems themselves, AI is optimizing scheduling, resource management, staff allocation, and reducing waste, making everything more efficient. And in documentation, AI helps with charting and writing summaries, freeing up doctors to spend more precious time actually with their patients. Here's a real-world case. In intensive care settings, AI models predict complications and adjust alerts, helping clinicians intervene much earlier. Research by Azra Bihorak, for instance, focuses on AI models that monitor ICU patients' severity and predict acute kidney injury. All of this points toward a more proactive, continuous health model, moving away from episodic visits and towards ongoing care. But what about the risks? In our final segment, we'll peek into the future, the promises, the dangers, and how this all reshapes the doctor's role in the next 5 to 25 years. Let's imagine these trajectories and how humanity might adapt. In the next 5 years, we'll see AI increasingly assisting diagnostics as standard support tools. AI decision support will be integrated into more clinics and hospitals. Robots will be used for more minimally invasive surgeries, still firmly under human supervision. AI in triage, monitoring, and remote care will expand widely. Crucially, regulation, standards, interpretability, and safety protocols will mature significantly. Looking ahead in 10 years, hybrid human-AI teams will likely dominate medicine. Some semi-autonomous surgeries might be approved in very controlled settings. We'll see personalized AI models for each patient, combining genomics, lifestyle data, and continuous health metrics. Healthcare is shifting to be way more preventive, spotting diseases before any symptoms pop up. And some routine doctor tasks, like paperwork and basic triage, will be largely automated. Now, fast forward 25 years. AI systems may independently manage many aspects of patient care, with doctors primarily overseeing high-level judgments. Fully autonomous surgical systems might become common in low-risk domains. The role of the doctor will evolve dramatically, becoming more of a health strategist, empath, overseer, and ethicist. Universal health access may expand as AI lowers costs, especially in underserved regions. We might even see AI hospitals, where most operations, monitoring, and care management are AI-driven. But this grand vision carries caveats: bias, accountability, interpretability, data privacy, unequal access, and of course, the irreplaceable human touch and trust. Doctors won't vanish. Their roles will simply change. In 25 years, a physician might rarely make a diagnosis entirely from scratch. Instead, they'll validate, interpret, communicate, manage exceptions, and care for human needs that no machine can fully replicate. AI versus doctors. It's not a battle. It's a profound transformation. AI is not here to replace, but to augment, to partner. Today, we see AI excelling in pattern recognition, high-volume analysis, and precision assistance. We also see its current limits: potential for bias, opacity, errors, and a clear lack of human empathy. In surgery, AI is gradually earning trust in controlled settings. In patient care, it helps monitor, predict, and support in amazing ways. A future of teamwork of humans and AI is way more likely than just AI replacing human jobs. Your health may one day be managed by a symphony of human and machine, and your doctor will be your trusted guide through it all. If you enjoyed this journey and want more deep dives into how AI would influence and challenge current jobs in various sectors, please click that subscribe button on Surviving AI. We love exploring these topics with you, and share your thoughts in the comments below. Would you trust AI to diagnose or even operate on you? Let us know what you think. Thanks so much for watching. Stay curious, stay critical, and most importantly, stay human.